Hello and welcome. My name is Sven de Keersmaker from Belgium, and together with Nina Grennan and Franson McKinley from the USA, we have developed Guide on behalf of the Nurses Connect group. Guide is a communication framework that will help you have better conversations with your patients through their cancer treatment journey. These conversations will make it easier to educate, guide and empower your patients in the shared treatment decision. While Guide aims to improve the benefits of interactions between nurses and patients with colorectal cancer, the principles can be more widely applied to interactions with patients with any other cancer. This program is aimed to GI oncology nurses and nurse practitioners around the whole world. We use the name nurse for the whole group.
The 5 letters in Guide each represent a crucial step in your conversations with your patients. G, gain insight in the goals of the treatment and care. U, understand the gap in the patient's knowledge. I, inform and educate. D, direct additional support. And E, empower the patient. In each step, we will show you what you need to know, what you need to explain to the patient, and how you will educate the patient. We will also show you what you need to avoid in patient conversation. When applying the Guide framework, you will notice that it has a flexible approach. You will develop your own preferences in regards to how many steps you move through in the first appointment and how you approach subsequent visits, either face-to-face or the telephone. This will vary from patient to patient depending on the circumstances. The capacity to hold and absorb additional information, or whether or not they have a carer with them. In our case study, we will focus on Sandra, a 51-year-old woman with metastatic colorectal cancer, KRAS wild type. She was initially diagnosed with locally advanced disease. It was treated with resection and adjuvant chemotherapy. Unfortunately, 16 months later, she progressed with liver metastases and was started on first-line systemic chemotherapy with FOLFOX, cetuximab. Eventually, she progressed and went on to receive second-line chemotherapy with FOLFIRI, bevacizumab. She is now meeting with our oncologist, Paul, who tells her that she has progression of disease, and he plans to treat her with targeted oral therapy, regorafenib. Sandra came to the appointment alone because she did not expect to hear this news.
Step 1 of the Guide communication framework is to gain understanding and insight into the goals of treatment and care. By taking a proactive approach to being a part of the multidisciplinary team, you will better be able to understand the treatment plan and why it was chosen for the patient. In this step, you will need to understand the goals of treatment and care and the rationale for the treatment that was chosen. Our patient Sandra has just left her consultation with oncologist Paul. Anne will speak with her now, but first she'll catch up with Paul.
Come in.
Hi, Paul.
Hi, Anne. Please.
Can I quickly check what you've just discussed with Sandra Jensen?
Sure, no problem.
Great. So what's her current status?
Well, unfortunately, she progressed on the FOLFIRI plus bevacizumab we gave her in the second line.
Okay. What are you planning to give Sandra for third-line treatment?
Well, we discussed starting regorafenib.
Okay. Can I just understand, why is regorafenib the best option for Sandra at this point?
Her performance status is good. She doesn't have disease-related symptoms, and her liver function tests are well preserved. Her only complaint is of fatigue. She's very motivated to receive further treatment, as she really wants to attend her daughter's graduation in 3 months' time. I feel this is a good option at this time to stabilise her cancer.
Okay. I'll meet with Sandra to review the treatment, provide information about side effects management, and answer her questions. Anything else I should be aware of?
No, I think that's it. Thanks.
Hello again, Mrs. Jensen.
Call me Sandra.
Okay. Dr. Ross has updated me on what's currently going on with your cancer and your status. He told me you've just had some unexpected news.
Yes, the cancer's growing again.
But Dr. Ross also told me your liver function is good and that he talked to you about starting a new treatment, didn't he? To try and get the cancer back under control.
Yes, although I haven't remembered everything Dr. Ross has just told me. Apart from being tired, I was feeling just fine, and now the cancer's growing. I just can't believe it.
I'm pleased you say you're feeling well despite some tiredness. And it's completely normal and understandable to feel confused now. Don't worry, I'm here to give you more information and answer all of your questions. We'll take it step by step.
Thank you, I appreciate it.
I think it's good to give you some time to let the news sink in first. What I will do is give you some information on the new treatment called regorafenib. We will go over all of the information, but if you like, you can have a read through this when you get home. I'll start arranging all of the paperwork.
Okay. To be honest, I'd really like to go home. I need to talk to my husband.
Of course. It's a lot to process. Before you do go home, just let me run a couple of checks, such as quickly take your blood pressure, and then I can let you go. Okay, so I will give you a call tomorrow afternoon to talk about the next steps. Is that okay? And then we'll take it from there.
Yes, thank you.
You have now seen that being a part of the team that makes the treatment decisions allows you to more fully understand the plan and goals of care and to support the patient. Anne made the patient feel that she is the knowledgeable and go-to person that Sandra can rely on throughout her treatment journey. We'll now show you a few things to avoid in this step.
Mrs. Jensen. So, Mrs. Jensen.
Yes.
You've just seen Dr. Ross, correct?
Yes.
Well, what did he tell you?
Well, I've not remembered everything Dr. Ross has told me, but apparently the cancer is growing again and I don't know what to do.
Okay. I'll have to find out, but I'm sure there are other options.
Well, Dr. Ross did mention some other drug, but I don't really remember the name.
I'll try and see if I can find it. Was it regorafenib? Sorry, it's always a bit of a search for me as well.
I think so.
Step 2 of the guide communication framework is to understand the gaps in the patient's knowledge. You can achieve this by using the ask, tell, ask method. Ask the patient what they understand, tell them what they need to know, and then again ask for their understanding and comprehension. In this step, you need to know that the level of knowledge and understanding may vary from patient to patient. By recognizing the knowledge gaps, you will be more effective at educating the patient. And also remember that the level of understanding for the carer will be important. Sandra is now at home and Nurse Anne gives her a call.
Hello?
Is this Sandra?
Yes?
Hi Sandra, it's Anne, your oncology nurse from the hospital. We briefly spoke yesterday and I promised to give you a call today.
Oh, hi, Anne.
How are you today? Did you manage to have a good talk about things with your husband?
Yes, I talked to him and I decided I really do want to start this new treatment.
Oh, good to hear that. Do you know what the next steps are now?
Well, I think so.
Is it okay if we briefly go through the next steps anyway? Just to make sure we're on the same page.
Of course.
I contacted the pharmacy yesterday and the regorafenib tablets are ready for you to pick up. We'll start with a low dose and if things go well, we can increase the dose after a week. Are you okay with all that?
Yes. Well, will I be able to attend my daughter's graduation? I'll need to travel to the other side of the country for that, and is that even possible with this drug? What if I get side effects at night? Surely I can't reach the hospital then.
I understand you have a lot of questions. When you come in to pick up the drug, I'd like to take the time to go over the treatment plan together and answer all your questions. I have a spot tomorrow afternoon or next week. What would you prefer?
Oh, thank you. Tomorrow afternoon would be good.
It's always easier to remember and understand things if someone else is with you. Is there anyone available who could come with you tomorrow?
That's a good idea. I'll ask my husband if he can come.
Oh, great. In the meantime, please do write down all of your questions and bring them with you tomorrow. Remember, all questions are good questions.
I will do that. Thank you, Anne.
Thanks, Sandra. We'll speak tomorrow.
Thanks, bye.
Bye-bye.
You have now seen the importance of the ask, tell, ask method. Asking the patient what they understand so that you can more effectively build from that. Here we'll show you a few things to avoid in this step.
Hello?
Hi, Sandra. It's Anne from the hospital. I'm calling about the start of regorafenib.
Yes, I remember. Well, I talked about it with my husband and I do want to start this new treatment, but I don't really know what to expect from it.
Oh, well, the doctor can tell you about this in your next visit. You can pick up the drugs at the pharmacy from today.
But how does it work? Will I be able to attend my daughter's graduation? I'll need to travel to the other side of the country for that. Is that even possible with this new drug? What if I get side effects at night? Surely I won't be able to reach a hospital then.
Sorry, Sandra. I don't know. I just called to tell you that you can pick up the drug now and get started with treatment.
Oh, okay. I guess I'll do that then.
Okay. Bye.
Step 3 of the Guide Communication Framework is to inform and educate. Having an appropriate level of understanding and knowledge will help you better inform the patient. You should be familiar with the disease and common symptoms, diagnostic studies, the treatment aim and goals, and common side effects and how to proactively manage them. It is important to be aware of what information is relevant for the patient, their knowledge level, and the patient preferences. Sandra now comes for a visit and brings along her husband, David.
Sandra Jensen?
Hi, Anne. This is David, my husband.
Hi, David. Good to see you. Great that you could join your wife at such short notice.
Of course.
So, 2 days ago, you heard the news that your disease is progressing. When we spoke yesterday, I sense that you're keen to start regorafenib as soon as possible. Is that correct?
Yes.
I also sense you'll have lots of questions about the treatment. Is there anything specific?
I want to know as much as possible, right, David?
Yes, we need to understand as much as we can.
Well, are you familiar with the goal of this treatment?
I'm hoping it will make me live longer.
That's one of the goals, yes. Regorafenib is a cancer growth blocker. It aims to stop the cancer growing for a while, but we're also aiming to reduce the symptoms you're experiencing, like tiredness. One thing to be aware of with this treatment is that you may feel more tired at first before it gets better. That's because it takes a couple of weeks before the drug has started to stabilise the cancer and you can feel the effect.
Okay, well, that's good to know.
As you know, the tablets are ready for you at the pharmacy, so you can pick them up right after this visit. Do you know how often you take them?
Well, once a day.
That's right. You'll be on treatment for 21 days, followed by 1 week off from treatment. We'll start with a low dose of 2 tablets, and if that goes well, we'll increase the dose after a week to 3 tablets. If that continues to go well, we can increase to the full dose, which is 4 tablets per day. You'll need to take the pills with a drink of water after a low-fat breakfast. There are examples given in the handouts we provided you. Rest assured, we'll keep a close eye on you all along. I know you may have heard some of this before, but we often repeat important information a couple of times, as we realise it can be a lot to process all at once. Shall I explain more?
Yes.
What do you know about the side effects?
Well, I read something about rash. Is that right?
Yes, and I think diarrhoea was mentioned in that leaflet as well.
That's right. There is a specific type of rash that might occur during treatment, which can appear on your hands and feet, usually within the first 2 weeks of treatment. This is called hand-foot skin reaction. Let me give you some information on how we can try and prevent this happening. Other common side effects are diarrhoea, nausea, changes in your liver function and high blood pressure. If you are feeling sick or have diarrhoea, you can try using anti-nausea or diarrhoea medication. They're mentioned here as well. Do you have those at home?
I do. It's good to know I can just use that.
Yes, you can. However, it is still very important to always contact us if you have side effects or need help with the management. In most instances, there is something we can do to control or minimise the side effect, like referring you to a dermatologist.
So, if I have a side effect, should I just call the hospital and ask for you this time?
This leaflet will remind you again of all the contact details. You can call this number 24/7. Don't hesitate to call us. You can ask for me, but if I'm not around, my colleagues are here for you. Is it clear to you what you can expect and how to contact us?
Yes, I think if I have a side effect, I'll give this number a call.
You have now seen that an appropriate level of knowledge is essential for educating the patient. Let us show you a few things to avoid in this step.
What do you know about the side effects?
Well, I read something about rash. Will I get that straight away or later on?
It can vary really, but don't worry too much about it. I suggest you go to the pharmacy now and call us if you have any other questions.
But how can I reach you?
Just call the hospital. They'll put you through to someone. You can always find the number on the website.
Step 4 of the Guide Communication Framework is to direct to additional support. We call this Beyond the Drugs. In this step, you need to know the options for additional support. You need to know how to have a difficult conversation around social, emotional, financial issues, and also remember that you will be providing support for the carer during this time. In this scene, you will see that David is worried about his wife and that he also requires support from our nurse, Anne.
So, is there anything else you'd like to discuss today?
Well, she probably won't like me saying this, but I'm a bit worried about that fatigue you just mentioned as a possible side effect.
Why are you worried about that?
She already has so little energy. Doesn't go out. She spends most of the days on the couch in her PJs, to be honest.
Well,
it's true. You just spend your days worrying.
Sandra, I realise you'd rather have David not bring this up, but I am really glad you did, David, as I'm here to work with you to address other things like this, where you may need support.
Yeah, okay, I know it's...
Having cancer is hard for your body, but also for your mind. A lot of patients deal with anxiety, depression. I'm not saying that's what you have, but it is really common. In our hospital, we have a team specialised in the impact of having cancer on your mental health. Would you like an opportunity to talk to them and see if this is something that may be helpful for you? I think it's a good idea.
I never thought I'd say this, but yes, it might be good to get some help.
Okay, then I'll arrange that for you. They'll give you a call as soon as they have a spot. I'm just thinking, you live quite close by, correct?
It's just a 10-minute drive.
There is this physiotherapist not far from here who runs an exercise programme for cancer patients. The good thing about that programme is that they go outside a lot. I don't know if you feel well enough to exercise a bit, but if you are, It can really improve the tiredness you're experiencing.
I don't know.
Go. Do it. It'll be good for you.
Well, I'm just going to write down the details for you and you can contact them whenever you like. Okay?
Okay.
You have seen how Anne supports Sandra and David through the treatment journey and beyond the drugs. Let us show you a few things to avoid in this step.
Well, she probably won't like me saying this, but I'm a bit worried about that fatigue you just mentioned as a possible side effect.
Oh, that'll be fine. Most patients find they get tired on treatment. Sandra, just call the hospital if it gets too much. There may be something we can give you for that.
Okay.
But...
Do you have any other questions, Sandra?
I don't think so.
Step 5 of the Guide Communication Framework is to empower the patient, making them feel that they're a part of the treatment decision and that the team is there for them every step of the way. In this step, you need to keep in mind the importance of personalized care, keeping a positive and hopeful approach, and remembering that information may need to be reiterated. Anne now takes the opportunity to talk to Sandra and David about this.
So, we've discussed a lot today. How do you feel now?
Well, I was panicking a bit yesterday, but now it's all much clearer.
Ultimately, you are the one in control and who knows what you're experiencing. Dr. Ross, myself and the rest of the team are here for you to partner with you, support and advise.
I definitely feel more in control now.
Good. So, about next steps. I think you talked about goals with Dr. Ross, didn't you? And what is your goal for this treatment?
Well, of course, I hope it'll make me feel better and live longer. But the most important thing is to be able to attend my daughter's graduation in 3 months' time.
Then that's what we're working towards. Is there anything else you need at this point? Any questions or concerns?
No, I don't think so.
David?
No, it's clear to me. Thank you.
Okay. I'll give you a call 1 week from now to see how you're doing.
Okay.
In the meantime, do not hesitate to contact us any time if you have questions or experience side effects. Do you know how to reach us?
Yes, I do.
Great. We'll be in touch next week then.
Yes, thank you very much, Anne.
That's okay. I'll show you out.
You have now seen how Anne made Sandra feel empowered and important throughout her treatment journey. Here are a few things to avoid in this step.
So, we've discussed a lot today. Do you understand what you need to do?
Yes, I think pick up the drug now and get started.
Yes. Please use it according to the prescription, otherwise you won't benefit as well. Any other questions?
Well, do we need to come back for a checkup?
The people at reception will go over that and have the diary. Please do call us if you need to, though, okay?
Okay.
Thank you for watching our video on the Guide Communication Framework. You have seen how to explain the aspects of colorectal cancer and its treatment that is essential for the patient to understand. How to make your relationships with patients as supportive as possible. To enhance understanding and drive adherence. We hope that these interactions, these examples are very useful for your own practice. Feel free to share this video with your colleagues, and if you want to have more information, you can go to our site nursesconnect.info.